Hi, my name's Darren Chandler at Go2imaging.com. Now, I'd just like to share a quick case history with you, just to give you a little indication of what we see on a regular basis and why it's so important to understand how to read people's images when they come to the clinic. Here we have a 29-year-old male who was suffering with left lower back pain and sort of pain sciatica going down into his left leg. It reports that it came on after he was playing football. He had instant lower back pain, and then the sort of numbness gradually came on thereafter. It wasn't improving. He did see another therapist prior who had diagnosed he was getting this condition called piriformis syndrome, because a lot of the pain was in his bum, and hence they thought that the sciatic nerve was getting compressed at that level. So I sent this patient for an MRI scan, and I've highlighted 3 lines, so don't worry about anything else. But what it clearly shows from this particular consultant radiologist is that there is no posterior disc present, okay? Which basically means there's no disc lesion, it's not leaking, there's no disc compression of the nerve. And you can clearly see on the second line that there is no nerve root compression identified. So the overall conclusion was that there was a mild tear in the annulus, which is the casing of the disc, but there was no nerve root compression. So here is that MRI scan. Now on the left-hand side here, it looks pretty unremarkable. There's some narrowing of the L5 disc at the back, but doesn't necessarily mean that it's a pain source. You could say that there is a marginal posterior sort of retrospondylolisthesis of the L5 on S1, mild as there's a slight overhang. But again, is it relevant? Maybe, maybe not. But what we're more interested in is this picture here. Now, for those of you who are not sure what you're looking at a cross section, and you're going up the patient's spine. So this actually is the right-hand side of the patient, and this is the left-hand side of the patient. Here is the intervertebral disc, and either side you have your facet joints, and in the middle here is your spinal canal. Now what you can clearly see is that this disc has actually leaked. There is a small broad-based disc protrusion, and that protrusion, unfortunately, is indenting in this grey little area just here. Now this tissue is what's known as descending S1 nerve root. So that is a nerve that's a part of the sciatic nerve, and it's clearly being indented at that little segment, which is known as the lateral recess. Now, we've only got to go back to this, and it clearly says that there is no nerve root compression. And there's certainly no disc bulge either, because it says there's no disc protrusion. But actually, when you do look at it, there is a disc protrusion and there is nerve root compression. Now, I just wanted to share that with you because it's something that I see on a daily basis. And again, if you're not proficient in looking at the scans yourself, you could then, like I say, go on maybe like the other therapists to do 8 treatments on sort of working into the piriformis muscle to relax it, to reduce the compression, when actually the compression was higher up. Thank you for watching.